Flossing is kind of a big problem for a lot of young kiddos because it's kind of a new sensation. So I'd say usually start introducing floss when they're younger and their front teeth with the little floss picks now are really popular. Have them play with it, kind of get used to the sensation of a piece of string going between their teeth. And once back teeth start touching, it's much easier to kind of transition from flossing front teeth to back teeth. And these are really the only way to get food and bacteria and other things in the mouth out between the teeth, which is a really common area to develop cavities for kids. If you guys really struggle with establishing a flossing routine at home, I would say another way to compromise for that is kind of work on the diet side of things a little bit more. So if you think about, if there's nothing to floss out of the teeth, then maybe flossing become less important. So if your child eat a very high carbohydrate diet, a lot of sticky stuff like gummy bears, cookies, goldfish, crackers, things that get mushy and kind of get stuck on teeth for a long time, then it becomes a little bit more important to floss at nighttime. But if they're not as big of a snacker, they kind of just eat a lot of fresh fruits and yogurts and cheese, and there's not a lot of big concern for cavity causing things to get stuck between the teeth, then maybe it's less concerning to be flossing every day. So I would say, it's kind of a debate you can have with your child and say, if today you want to have these type of snacks, we have to make sure we floss at night. And if you don't want to floss tonight, then we'll have better snacks, and better snacks being fresh fruits, veggies, and cheese, things that won't get stuck on teeth for a long time. And also keep in mind, just because something is natural and organic doesn't always mean it's good for teeth per se. It might be great for the overall nutritional value. For example, fresh fruit versus dried fruits. Like you can get dried mangoes and apples, and I'm sure they have great nutritional values, but they're very sticky. So if your kid eats something very sticky, it can get stuck on their teeth for a long time. Whereas if they ate like a fresh apple, it's not as big of a concern for causing cavities.